Why am I here this weekend in addition to showing you how to see human health? Why else might I be here this weekend? In the 1930s, and perhaps actually 1930, that is when the Centers for Disease Control started keeping records of the leading causes of death in the United States. So we're coming up on 90 years, 95, 94 years. In May of 2016, the CDC released their annual report on the leading causes of death in the United States. They do it every year. Who knows what the number one leading cause of death in the United States is and has been since the 1930s? It has not changed. It's still number one. Yes. Yes, it is heart disease. And I always ask this question, if it's been the number one leading cause of death in the United States for almost 100 years, then how effective are our treatments, our medications, our recommendations for diet, fitness, and exercise? Why aren't we seeing, if we've targeted this as number one, public enemy number one to health, why aren't we seeing our technology, our medicine having this drop in rank if what we're told is heart health? Okay. Well, I mean, something's always going to be number one, but I'm just saying, can't we see some effectiveness? I mean, are people just ignoring the diet, fitness, and lifestyle? But still, you would think that some medications would have some effect to bring that down. But no. So, what about number two? Then we know the second leading cause of death in the United States. Cancer. Now, all cancers, not any individual cancer. And again, with all of our technologies, we don't see it really dropping from number two. Now, the third leading cause of death in the United States. Does anyone know what the third leading cause of death in the United States? Now I'm going to say this report came out in 2000. This came out in 2016, and they did it again in 2018, and then COVID hit, and now they're saying COVID-related stuff is the third leading cause, but COVID stuff is going to eventually dilute or whatever. But third leading cause of death? Medical errors. So basically, going to healthcare. And this is not opinion necessarily. This was published in the British Medical Journal on Tuesday, May 3rd of 2016, shows that, quote, medical errors in hospitals and other healthcare facilities are incredibly common and may now be the third leading cause of death in the United States, claiming 251,000 lives every year, more than respiratory disease, accident, strokes, and Alzheimer's. Martin McKay, a professor of surgery at Johns Hopkins University School of Medicine who led the research, said in an interview that the category includes everything from bad doctors to more systemic issues such as communication breakdowns when patients are handed off from one department to another. This is my favorite. Quote, it boils down to people are dying from the care they receive rather than the disease for which they are seeking care. Now, there are warning labels on products in the United States that you can purchase, okay? The Surgeon General has determined, but there are no warning labels on the hospitals or the doctor's office or any indication to let you know that you are entering a potentially harmful environment as you seek care. Now, I understand if you go to the doctor to get a blood test or get your blood pressure taken and your temperature taken, probably going to be okay. But it's when you start falling into the delivery of care or the treatment is when that environment changes. So, my message this weekend and always from now on is not don't go to your doctor. Don't get health care when you need it. That's not my message. My message is the best thing you can do is stay healthy for as long as you can so that you do not need to reach out to a system of care that is harming people. And again, I'm not saying that this is diabolical from health care. I think it is more systemic. I think it's just the way that we've kind of set up the healthcare system. When patients get handed off, as I've worked with different doctors, and we were collecting medical records from other doctors. They were vastly different. It wasn't like there's standardized medical information, or like when I went to Canada, and you know, it wasn't like everybody was reading off the same page. So I could see how easily it would be for medical information to get lost or ignored just in getting medical records sent from one another, which can then result in, you know, people on a cocktail of pharmaceuticals that can be harmful. So again, and what we're going to talk about this week is, or this weekend, is what you can do when you leave, what you can do to be as healthy as possible so that you can avoid, for as long as you can, reaching out to a system of care. Now, I do want to say, as much as I'm going to challenge healthcare this weekend, I'm also going to acknowledge the people in healthcare. And I was in a situation recently where I was with a few hundred people in a rather remote location. And we had a woman in her 90s go non-responsive and unconscious. And it was going to be 2.5 hours before any paramedic or ambulance or anything was going to get there. Now, fortunately, we were in a situation where there was a surgeon present in the group and 2 adult nurse practitioners. And we had some medical supplies. I was there to assist with the surgeon and the 2 adult nurse practitioners in finding the supplies they needed. That they, you know, it was basically like suture, scalpel, but we weren't doing surgery. But they knew they needed to get this person on IV fluids, stabilize oxygen level, stabilize sugar level until someone could arrive. So basically did that for 2.5 hours. And I want to say, and I was there, right? I was right there with the person that was unconscious and right there with the team, just getting them what they needed. I was basically the runner. And I want to say after 2.5 hours, and finally when the paramedics arrived and there was a sense of relief, I was exhausted. Because there was a lot of investment, because at one point, the one nurse practitioner said, she's doing end-of-life breathing. This is how people breathe. Like the rate and the depth, you could tell that she wasn't breathing normally. And she was just calling it end-of-life breathing. And I was like, oh my gosh, this person might pass away. And here's a situation where being intuitive isn't really going to do much. Here's where this person is genuinely going to need medical care. And, you know, then the paramedics did arrive, and she was, you know, taken into the ambulance and taken care of. But I thought about that this is what people in healthcare, especially in hospitals or emergency rooms, go through every day. So I certainly do have an appreciation and admiration, because I was exhausted just after 2.5 hours. You know, sometimes these people are doing 10-hour days, day after day in the emergency room, and you know, so I do want to acknowledge the people in healthcare.